Oh, good afternoon, everybody. Before we go over the COVID-19 numbers, I do want to congratulate President-elect Joe Biden. President-elect Biden has promised to be a president for all Americans, and I'm going to take him at his word, and I hope the people in our state will give him the same opportunity to follow through on this commitment. My administration fostered a relationship with the Trump administration so that when Kansas has needed supplies or support during the pandemic, we've been able to communicate and receive the assistance. My team has already started conversations with President-elect Biden's transition team to make sure we are positioned to continue to have an open line of communication with the federal government, to leverage the resources necessary to keep Kansans healthy and protect our economy. I'd also like to take a moment to acknowledge that Veterans Day is tomorrow. I want to personally extend my thanks and gratitude to our military veterans and to their families. Of all the holidays, Veterans Day has sort of a special meaning for me. My father was a career Army who served during World War II and received the Purple Heart during the Korean conflict. I spent my childhood on Army posts all over the United States and in Japan and in Germany. One of the many great things I found when I moved to Kansas was how hospitable our state is for veterans and their families, and the strong tradition we have here of supporting and honoring them. So tomorrow's an opportunity to recognize contributions of the 17 million veterans in the United States, including over 200,000 right here in Kansas. Okay, now on to the numbers review. Please note that because we held this week's briefing today rather than tomorrow in observance of Veterans Day, we are actually between reporting periods. Therefore, the following numbers are current as of Monday, November 9th, and do not include updated numbers from today. Between Friday and Monday, Kansas reported 5,920 positive COVID-19 cases and 15 new deaths. This brings us to a total of 103,553 cases, 4,138 hospitalizations, and 1,181 deaths. It was another, unfortunately, record-setting weekend in Kansas for virus spread. Cases are spiking across the state, hospital beds are filling rapidly, and some schools are discussing plans to return to remote learning. Last month, I announced that because of the continued rise in cases and deaths, I would be reaching out to Republican leadership to determine a path forward. As part of that conversation, Republicans asked that before we took the action of calling a special session, we collaborate to create a public service campaign to increase mask participation. They also suggested working with local leaders to assist them in implementing their own community mask requirements. In response to the COVID spike in Kansas and many of our neighboring states, my team has worked quickly on a number of actions to slow the spread of the virus. I'll have more information to provide at next week's press conference on the multifaceted approach we're taking to combat COVID-19, which will include an update on the unified testing strategy, a public service campaign, and masks. Before I move on, I do want to commend the Jefferson and Lyon County Commissioners who reversed course and voted to mandate masks in their counties just recently. The evidence on mask wearing is clear. As cases continue to increase, it's critical that we implement common sense steps like mask requirements, physical distancing, and avoiding mass gatherings. These tools are the best option we have to protect Kansans, our economy, and keep our schools open. I want to end today with an update from Dr. Norman on hospitalizations. Over the weekend, Kansas reported 71 new COVID-19 related hospitalizations. Hospitals in both rural and urban areas are experiencing increasing strain. Yesterday, the Wichita Eagle reported that all of the estimated 208 ICU beds at Wichita's two major hospitals, Ascension Via Christi and Wellesley Healthcare are full. COVID-19 patients occupy 80 of those beds. If a hospital is at capacity for bed space, particularly in its intensive care unit, we run the risk of Kansans not having access to medical care when they need it most. The rising number of hospitalizations is certainly cause for concern. The Kansas Department of Health and Environment regularly monitors our hospitals' capacities, both urban and rural. And with that, I'd like to turn it over to Dr. Lee Norman, KDHE Secretary, to provide a more detailed update regarding the state of hospital bed space. Secretary.
Thank you, Governor. Good afternoon. KDHE and the Kansas Hospital Association convene weekly calls with hospital leaders, and I speak daily with executives who have questions and concerns. The lines of communication with hospitals are very open, and we are hearing similar themes from large and small hospitals across the state. Hospital beds, as the governor said, are filling rapidly, and staff capacity is constrained. There are two issues with hospital beds. We track hospital beds which are available, includes COVID beds and ICU beds across the state, which is one issue. We always know the status of the beds. The other issue is the availability of staffed beds. The data we use to monitor bed space and display on our COVID-19 dashboard is only as good as what is reported by hospitals into the federal reporting systems. Because of the time it takes to report into the system, sometimes the data we have may not show the complete picture at that moment in time. This is why we have open communication with hospitals, which is critical, to hear firsthand what is happening. Staffing constraints in hospitals happening because of the increased number of staff absent because of illness or waiting for their test results. Hospitals are working on and implementing bonus programs to incentivize staff to pick up additional shifts to cover for the shortage they are seeing of staff either out because of illness or for those awaiting test results. Transfer of patients is another area of concern. Hospitals are receiving calls on a daily basis from multiple states who need to transfer very ill patients, but hospitals are unable to accept them because of bed or staff capacity. We are working with our hospital leaders to identify temporary staff solutions, as is the rest of the country, knowing that cases remain on the rise. Hospital admissions are the result of community spread. We need community support to push down the spread of the virus. We must protect our communities and frontline workers. The commitment of all of us to wear masks, socially distance, and reduce the spread is critical to not overrun hospital systems. I'd also like to add the caveat that it's important to remember the influenza vaccination, because the competition for beds is getting steeper all the time, and it doesn't make any difference if it's an emergency admission, an influenza, or COVID-19. They all compete for the same beds, but influenza is something we can do something about through the influenza vaccine. With that, that's the last of my remarks. I'll turn it back to you, Governor Kelly.
Okay, any questions?
Yeah, Governor, the unified testing strategy depends, it seems, in some part, right, on expanding capacity with this CARES Act money and hiring the private contractors. How close are you to naming the contractors?
I think we're probably ready to do it. We signed our last contract either late yesterday or today, so I think the list is ready to go out.
Will we see that today?
Ashley, will that be released today?
Today or tomorrow.
Okay, so you'll get it.
Okay, and talk a little bit about the importance of the testing strategy to combating this surge of virus that we're seeing.
Well, it is absolutely an essential tool in diminishing the number of positive cases, but it won't work alone. You know, we do have to have a comprehensive testing strategy that tests both symptomatic and surveillance, and then ultimately asymptomatic. But we also, it won't work if people are not abiding by the other safety protocols, particularly wearing masks and avoiding large gatherings.
Governor, other governors in their states, Republican and Democrat alike, have taken smaller steps, restrictions on things like capacity bars, size of mass gatherings,
You know, right now, we have not gone down into the weeds on each of those. As you know, a lot of our counties have put in their own limitations, and I think pretty much on a regular basis, the local county officials are working on that. I think we just had some activity down in Sedgwick County. I know we've had some here. So we're going to continue to work in that fashion unless the data drives us to do it differently. But right now, I think working in partnership, we'll just continue to do it that way.
Is there a red line in the sand as far as when the data will drive you to do it differently?
You know, that's part of the kind of, one of the outputs I want from the collaboration with the Republican leadership is that we sit down and decide what the data are that will drive the push for local mask mandates. And we will hopefully come up with a consensus on that. Because as we have seen, you know, if we don't have consensus, you know, and we don't have robust enforcement, it's going to be very, very difficult to get anything done. So I think we're going to continue to work that way.
Governor, on the mask.
But I will tell you, you know, everything is on the table, you know, so that if we cannot come up with a consensus that will work, you know, we will revisit that.
Finding consensus could be hard. I had the opportunity to drive to Colorado on I-70, mask wearing in all those towns you stop to get gas. It's terrible. They're not wearing masks with impunity in rural Kansas. How are you going to convince people with a public service announcement to do something they refused to do for 9 months?
Well, Tim, it will be a multifaceted approach. You know, it certainly we will use the public education. But the other part of it, and particularly in working with the leadership, is to get them to work with their caucuses to then, and developing some community ownership on, you know, implementing, in leadership for this, so that we're calling on community leaders, elected and non-elected, to, you know, sort of form their own COVID commissions and work locally in ways that might actually convince the folks there to do what they need to do. You know, I also think that we've seen, you know, just because of the surge, you know, I mean, when you've got Jefferson County Commission switching over, you've got the Lyon County Commission switching over, I expect that we will see more as, you know, some of our rural communities are, you know, they're losing people right and left. So I think the data alone will drive them, but it also, we're hoping that with the robust, multifaceted approach that we're planning to roll out next week, that we'll be able to enlist the support of leadership, elected and local, to really educate their folks and, you know, do what works in their community to get people to rally around. That's what Kansans do.
The vaccine, we're hearing that there's armed guards delivering vaccines around the world. Is that kind of true? And what's kind of the update on the vaccine?
Well, we haven't had any vaccines delivered yet, so I haven't seen any armed guards. But, you know, there's no doubt that, you know, there will be security around the vaccines. There always is security around special supplies, so that won't be anything particularly unusual. But we're not going to see the first shipment of those vaccines until at least December. And even that will be limited and probably just be able to use with some of our frontline health workers.
What's your thoughts on canceling all these sport events? We're seeing a lot of outbreaks in athletes right now. Do you have any concerns on maybe switching over, kind of canceling games as we get closer to winter?
Well, I was just reading something on, you know, the concern that they're having about indoor athletics, and I think our school districts are starting to have those kinds of conversations, and I think they'll be making some decisions because, you know, we've gotten a little lucky with some of the contact sports that have occurred this fall, but they were outdoors. You know, everything will be moving indoors soon, and I think the school districts are having those conversations now.
That's a little tough for a basketball state, isn't it?
It won't be easy. Yeah, you're right. We'll have to figure out another way to shoot a three-pointer.
Governor, if you have COVID-19 and you live in the Wichita area, obviously you go to the hospital and they're not accepting any of these patients. Where are they supposed to go? What are they supposed to do? And is the hospital actually transporting them to another hospital?
I think I'm going to let Dr. Norman respond to that because he's been working directly with the hospitals.
Yes, good question. Well, first off, today, matter of fact, was the day we had the hospital call, and both hospitals were represented on there. They have very good relationships. They understand what everybody's bed status is, and will transfer back and forth from hospital to hospital. There's also the ability to surge within their current footprint within their hospital. In other words, a routine medical surgical bed or room can be converted with a ventilator, a slight tweak to the staffing to make it an intensive care bed. So it's, and having lived my life as a hospital executive, I understand this very well, where you adjust and then you load level across the community. The ideal is not to have to transfer from one hospital to the next. You'd rather, wherever the patient presents, to hospitalize them there and then to surge up at that facility.
One more question.
Yeah, what seemed like a million years ago, back in March, there was a lot of discussion early in the pandemic about surge planning and alternative care sites and essentially the construction of additional hospital capacity. Those conversations don't seem to be happening now, at least from what I can tell. Is that not an option this time, or is that not something that's being considered in our current surge?
Yeah, good question. So the question is, have we been having ongoing discussions about either tents or temporary solid wall construction into which we could surge patients? And actually, those have been happening every time that we get together with hospitals, as recently as this morning. And it is very clear universally that the hospital executives and leaders would rather surge within their current footprint than to be one out, for example, in a tent in a Kansas fall or winter. And second, it doesn't solve the staffing problems. And so you could build all sorts of construction and not necessarily solve the staffing problems. At this point in time, beds are getting tight, but it's really staffing that we're most concerned about. And I think we'll be able to continue to surge on the current footprints of the existing facilities.
And just to follow up on that, is there a strain related to, we talked about staffing in the actual bed, is there a strain related to supplies such as medical gases and these other things that are needed for patients?
Yeah. Other things that are not necessarily specifically COVID because of supply chain in India and China, for example, where there's a few, but they haven't been manifest in Kansas. One of them is anesthetic drugs, for example, but we have not seen any limitations on the services provided because of a limitation of those products.
Thank you.
Thank you, Secretary. Would you recommend that the universities test people as the students are leaving Thanksgiving and then test as they come back?
I think that would be good if we have,
Some are, but I don't know if it's universal.
if we have adequate supplies. I think that would be smart.
This report about hospital status of the hospitals that may or may not come out today, is that going to be detailed? Are we going to know
Status of the hospitals?
about staffing and hospital beds? And I thought there was going to be an analysis.
I'm not aware of that, Tim, that there was a specific